we'll be covering lupus and cardiovascular. So a little bit about lupus, the patho. It's an autoimmune disorder that involves connective tissue changes and chronic inflammation. Some signs and symptoms that might resemble it or it might give you key factors is going to be fever, weight loss, malaise, extreme fatigue. The main people that are risk factors for this is going to be basically people of color. The age is usually around 15 to 45, and the gender that it usually tends to hit the most is women. The nursing intervention that you want to do is you want to basically minimize the exacerbations that the patient is feeling, that they're going through. The labs that are studied will basically usually show an elevated ANA, an elevated ESR, and also it will also key on anemia, thrombocytopenia, and leukocytosis. Now the medications that my patient that they were taking were hydroxychloroquine, furosemide, and folic acid, which I know for sure anemia is a big key factor in these people. And then on my cardiovascular, the patho behind that is basically it supplies oxygenated rich blood to body cells and tissues. Cardiovascular disease is the leading cause of death in the USA. Signs and symptoms that basically could key you in on it is going to be angina pectoris, nausea, fatigue, dizziness. Treatment should be medications such as antihypertensive. You want to improve basically the blood flow. You want to watch out for cyanosis. You want to watch out for neuropathy, anything of those things. And then the final resort usually is going to result in a CABG. Also, you want to maintain a low sodium diet. The labs that you would basically look at on this would be a BNP, a lipid profile, and an ECG. The main causes for anything concerning the cardiovascular disease would be hypertension, lupus, sedentary lifestyle, obesity, also diabetes. The nursing interventions, you basically want to modify lifestyle changes such as exercise and diet. And the medications that usually I give or gave to my patient would be amlodipine, carvedal, and a clonidine. Now my patient did receive a clonidine patch, so that was something new. And basically she received the patch, she wore it for 24 hours, and then she took that one off and she did a new one. And her assessment was BP 151/95, temperature 97.8.4, pulse 90, respiration 16. She was a 54-year-old African-American female. She was alert and oriented, self-placed, time, and situation. She basically had no abnormal findings on her except for the well-known butterfly rash. She did have family history of lupus in her family, which it was on her mother's side. She also knew that it would also start affecting her other body systems, so the body organs. And she basically maintains her medication regimen, and she also follows basically her medical appointments, and she knows pretty much well about her lupus and also how it ties into her cardiovascular.